There is something you did this morning that most people never think twice about. It took no more than 15 seconds. You have done it every single day of your adult life. And if you are over 60 and taking any kind of heart or blood pressure medication, that one small habit may be placing your heart under far more strain than you realize. Not occasionally, every single morning. I'm Dr. William Lee. I have spent more than 2 decades working in cardiology, and I want to be honest with you right from the start. What I am about to share with you is not a rare or exotic finding buried in some obscure medical paper. It is one of the most consistently overlooked cardiovascular risks I see in adults over 60, and the reason it keeps getting missed is simply this: a standard medical appointment rarely leaves room for it. What I want to do today is give you the knowledge, the understanding, and a simple morning protocol that I genuinely believe can protect you. And I want to do it in a way that feels clear, practical, and something you can actually use starting tomorrow morning. If what I am sharing today feels important to you, I want to ask you to like this video. It helps this kind of information reach more people who genuinely need it, and that matters to me. Let me tell you about a patient I'll call Harold. He was 71 years old, active, sharp, and by every standard measure, doing well. His blood pressure was managed. His medications had been stable for years. He was the kind of patient who made his appointments, kept his numbers in check, and walked his neighborhood every morning. The morning everything changed started exactly like every other morning had for 50 years. His alarm went off. He sat up quickly, swung his legs over the side of the bed, stood up, and walked to the bathroom. 15 seconds. He had done it that way his entire adult life. His wife found him on the bathroom floor. Harold had not had a heart attack. He had not had a stroke. What had happened was something quieter, more gradual, and far more common than most people understand. His body, at 71, with his specific medications, after a full night of sleep, simply could not keep up with the speed of that transition from lying down to standing. And what followed was a dangerous drop in the blood pressure supplying his brain. Stay with me, because the physiology behind this is something every person over 60 deserves to understand. And once you do, the morning protocol I am going to walk you through will make complete, immediate sense. Let us start with what is happening inside your body during those first 30 seconds of standing up. When you are lying down, your blood is distributed relatively evenly throughout your body. Your heart is working comfortably. Gravity is not a significant factor. The moment you stand up, approximately 3 to 800 milliliters of blood, roughly 1 to 3 cups worth, shifts downward into your legs under the force of gravity. Your body has a built-in response to this. Your sympathetic nervous system is supposed to immediately constrict the blood vessels in your lower body and nudge your heart rate slightly upward to push blood back toward your brain and maintain stable pressure. In a younger adult, this compensation happens in about 1 to 2 seconds. It is seamless. You never feel it. But research has clearly shown that this response time slows as we age. The reflex is still present, but instead of 1 second, it may now take 2, 3, or even 4 seconds to fully engage. That gap, those extra seconds, is where dizziness lives. It is where falls happen. And in someone with underlying cardiovascular vulnerability, it is where more serious events can begin. This phenomenon has a clinical name: orthostatic hypotension. Orthostatic simply means related to standing upright. Hypotension means low blood pressure. Together, they describe a well-documented condition in which blood pressure drops significantly within the first few minutes of standing, sometimes causing dizziness, lightheadedness, blurred vision, and in serious cases, fainting. This is not a rare condition. Research has shown that it affects approximately 1 in 5 adults over the age of 65. 1 in 5. And here is what makes it more dangerous than most people realize. It is not always dramatic. Many people with orthostatic hypotension do not faint. They simply feel briefly off when they stand, a moment of lightheadedness that passes in seconds, something they have quietly filed away as just part of getting older. But the research tells a different story. Repeated episodes, even mild ones, are associated with a meaningfully increased risk of falls, cardiovascular events, and cognitive decline over time. This is not something to dismiss or get used to. It is something to address. Now, let me add the second layer, because this is where the morning specifically becomes the highest risk window of your entire day. Your cardiovascular system follows a rhythm tied to your sleep and wake cycle. The hours between roughly 6 and 10 in the morning consistently show the highest rates of heart attack, sudden cardiac death, and stroke. The reasons are physiological. During this window, your blood pressure rises naturally as your body shifts out of sleep. Your blood becomes more prone to clotting. Stress hormones like adrenaline flood your system as it transitions from rest to wakefulness. Your body is doing significant physiological work in those early hours, and that work creates real vulnerability. Now add a third factor that most of my patients have genuinely never thought about. Many common heart and blood pressure medications have what pharmacologists call a trough period. This is the window during the day when the medication is at its lowest concentration in your bloodstream, providing the least protection. For most people who take their medications in the evening or before bed, that trough period lands in the early morning hours. Think about what that means. The window when your medication is least effective is the exact window when your cardiovascular system is most biologically vulnerable. Research examining the timing of blood pressure medications in older adults has found meaningful evidence that when you take your medication can significantly affect both how well it works and the level of risk you face, particularly in those morning hours. The fourth factor is something almost every patient over 60 I have ever worked with is doing, usually without realizing it carries a cost. Going to bed mildly dehydrated and waking up even more so. As we age, the mechanism in the brain that tells us to drink water becomes less responsive. Thirst sensitivity decreases. Many people over 65 also deliberately limit fluids in the evening to avoid nighttime bathroom trips, which is completely understandable. But by 6 in the morning, after 8 hours without fluids plus what your body has used overnight, your blood volume is lower and your blood is slightly thicker. Your cardiovascular system has less fluid to work with precisely when it needs to maintain stable pressure during a position change. So let us revisit Harold with all of this in view. He woke up with his medication at its lowest effective level. He was mildly dehydrated, his autonomic nervous system had slowed with age, and then he stood up quickly, directly into the peak cardiovascular vulnerability window of the morning. 5 compounding factors, all converging in 15 seconds. Harold is not unusual. He is one of the most common presentations I encounter, and the thing that stayed with me about his case is this. Every single one of those factors was addressable. None of this had to happen. I want to tell you about a few other patients because this risk does not always look the same, and I want you to recognize yourself or someone you love in at least one of these stories. Margaret was 67, a retired registered nurse who had spent nearly 20 years working in cardiac care. She knew what orthostatic hypotension was. She had helped patients manage it throughout her career. And yet she told me when she first came to my practice that she had never once applied that knowledge to herself. She had been experiencing morning lightheadedness for 8 months before her daughter convinced her to mention it at an appointment. The solution was not complicated: a medication timing adjustment and a commitment to drinking water before standing up. Within 6 weeks, her symptoms were gone. I spent 30 years taking care of everyone else, she told me at her follow-up, and miss this in myself. Margaret, I want you to know this is genuinely the kind of thing that gets missed by some of the most informed, attentive people I know. Comment below and tell me, have you ever experienced morning dizziness or lightheadedness and simply chalked it up to getting older? I want to hear from you, and I want you to see how many others reply saying the same thing. Then there was Gerald, 78 years old, a former contractor with the kind of physical confidence that comes from a lifetime of hard work. He had been dismissing morning dizziness for nearly a year. Just getting old, he told himself. The person who caught it was not his cardiologist or his primary care physician. It was his pharmacist during a routine medication review who noticed the relationship between his medication timing and his symptoms and asked the right questions. That conversation led to a referral, which led to a diagnosis of clinically significant orthostatic hypotension that had been present and completely undetected for months. Gerald is now 80. He takes his mornings slower, keeps water on his nightstand, and says with real feeling, "I listen to my pharmacist a lot more than I used to." And then there were two patients I saw around the same time, both in their early 70s, both on similar blood pressure medications, both living similar lives. I had walked one of them through a morning protocol at his last visit. His wife's physician, thorough and excellent, simply had not had time to cover it. One morning, she fell in their hallway and fractured her wrist. He told me afterward, "We were doing everything the same, and I had the information, and she did not." That felt wrong to me. He brought her to her next appointment with a written list of specific questions. That is exactly the kind of moment this conversation is designed to help you create. Now, let me give you what I want you to actually walk away with today. The morning cardiovascular vulnerability window is real, it is well documented, and it is preventable. Here is a 7-step morning protocol that I recommend that is grounded in real cardiology research and that costs you nothing except a few extra minutes and a little intentionality. The first step happens before you even sit up. Before the covers come back, spend 20 to 30 seconds doing ankle circles and flexing your feet up and down. Your calf muscles act as a secondary pump for your lower body, squeezing blood back toward your core. Activating them before you stand directly reduces the gravitational blood shift that drives orthostatic hypotension. 30 seconds, no equipment, enormous payoff. Step 2, keep a glass of water on your nightstand every night and drink it before you stand, 8 ounces at minimum. This directly addresses morning dehydration, increases your circulating blood volume, and gives your cardiovascular system the fluid it needs to maintain pressure during that position change. This single habit shift has made a measurable difference for many of my patients. Do not underestimate how simple and how powerful it is. Step 3. Sit on the edge of the bed for a full 60 seconds before standing. Not 5 seconds, 60. Use a timer if you need to in the beginning. Sitting upright is an intermediate cardiovascular position. Your body adjusts to partial gravitational load, giving your autonomic nervous system the time it needs to engage before you go fully vertical. This stage transition is one of the most consistently effective interventions used in geriatric cardiology for managing orthostatic hypotension. It is not about being slow or being careful in a fearful way. It is about giving your body the 30 seconds it now needs to do what it used to do in 1 second automatically. Step 4. When you do stand, do it next to something solid. A nightstand, a bedpost, a wall. Hold it lightly for the first few seconds. Not because you expect to fall, but because you are giving your system a safety margin during those critical moments of autonomic adjustment. This is intelligent cardiovascular management. Treating it that way changes how it feels. Step 5. At your next medication refill, ask your pharmacist this specific question. Given the medications I am taking, is there a timing that would be safer for my morning cardiovascular risk? Your pharmacist has your complete medication list and understands trough and peak periods in a level of detail that does not always come up in a standard appointment. This question is free, it takes 2 minutes, and it could be one of the most valuable conversations you have this year. Step 6. Begin monitoring your blood pressure each morning in a seated position before taking your medications. Log the readings and bring them to your next appointment along with this specific question written down. Can you check my blood pressure, both lying down and standing at my next visit? This is called orthostatic blood pressure testing. It takes about 2 minutes to perform in the office and directly tells your doctor whether you have clinically significant orthostatic hypotension. Many patients have never had it done. You now know to ask for it by name. Step 7. Share this protocol with everyone in your household who takes heart or blood pressure medication. Share it with your adult children. Share it with a friend who has ever mentioned morning dizziness. Because whether you have this information should not depend on whether your specific doctor happened to cover it in your last appointment. You have it now. Pass it forward. If you find this kind of in-depth, practical health information valuable, I would love for you to subscribe to this channel. Every video I make is built on the same foundation: real research, real patient experience, and information that is genuinely worth bringing to your medical team. Let me answer a few questions I know are forming as you process all of this. You might be thinking, I have gotten up fast my entire life without any problems. Why does this matter now? Because this is an age-related change in autonomic function, compounded by the higher likelihood of being on cardiovascular medications and a greater baseline dehydration risk. At 40, your system compensated so quickly that the vulnerability window was essentially zero. By 65 or 70, that window has widened in ways that are clinically meaningful. The same action carries a different risk profile at a different stage of life. That is not a flaw. It is biology, and biology can be worked with. You might also be wondering whether your doctor missed something by not bringing this up. The honest answer is this: your doctor is not negligent. There is genuinely more relevant information about senior cardiovascular health than fits into the available time in most medical appointments. What I encourage you to do is bring it up proactively at your next visit using the specific questions I have given you. You are not challenging your physician by doing this. You are helping them help you more effectively. That is a good thing. And if someone you care about lives alone and is over 65 and on heart or blood pressure medication, please get this information to them directly. A fall or cardiovascular event with no one present to help is a different category of risk entirely. And the protocol I have described takes less than 3 minutes in the morning and costs nothing. Let me bring you back to Harold. He is 73 now. His wife calls him her reformed morning person. He keeps water on his nightstand. He does his ankle circles before the covers come back. He sits on the edge of his bed for 60 seconds and looks out at his backyard. He told me he has started noticing things in those 60 seconds he had rushed past for years. His morning blood pressure readings are logged in a small notebook he brings to every appointment. He has not had a single episode of dizziness or syncope in 18 months. But there is one thing about Harold's story I want to leave you with. About 6 months after his own episode, he asked if he could share the morning protocol with the coffee group he runs at his local senior center. He printed it on a single sheet of paper and handed it to 23 people. 4 of them brought it to their own doctors and were diagnosed with clinically significant orthostatic hypotension that had never been identified. 1 of them had been experiencing morning dizziness for 3 years. 3 years. The information existed. The testing existed. The conversation simply had not happened yet. That is what I want this video to do for you today. Not to replace your doctor, not to frighten you, but to make sure that the conversations that can directly change your safety and your health actually happen. You deserve to walk into your next appointment knowing this. You deserve mornings that feel steady and safe. And with these 7 steps, with those 2 questions written down, and with a glass of water on your nightstand tonight, that is exactly where you are headed. Take what you learned today and use it. Your mornings are worth protecting.